Trust had been through quite a rigorous assessment process, decided that an EPR was the right answer.
My colleagues who were in post at that stage obviously looked at who was going to be the best vendor.
This is about patients and it's about creating a better way of working for our clinicians, and I truly believe that that's now been delivered.
We don't know how healthcare is going to change in the future, and we need a platform and a system and a partnership that will adapt to the needs of the future.
InterSystems were chosen for their Trakcare platform, mainly because it had global penetration.
It was round about October 2015 that we started to introduce Trakcare. It was rolled out ward by ward.
Everyone seemed to pick it up really easily. It's easy to use.
And even skeptics, as I call them, who didn't used to like it so much, have fallen in love with it. So they've used it so much now, they're much more familiar with it, and they find all the screens quite easy to navigate.
But once you start to deliver benefit, people then get behind it and they want more, and expectations rise. And that's certainly been our journey and our experience today.
For this sort of system to work within a hospital, the clinicians need to accept it, they need to understand it, they need to buy in.
So one of our phrases that we use is that we work with the willing, WWW, and that's because if you get those people that understand the benefits, they become the evangelists for change.
The strategy that the Trust went along was to develop clinical champions in the various areas that we started implementation.
Since Trak's been introduced, we've been able to see the whole hospital at a glance.
We use it to admit new patients direct from paramedics, track case notes to different departments.
The biggest thing we need as clinicians on an emergency ward is information. The more information about any patient we have, the better decisions we can make, the better care they get.
We can get a good audit trail on where patient notes are when we need them for different clinics and for the doctors who are coming in and asking for them.
And one of the biggest advantages with Trakcare is that it has that ability to give us that information.
Yeah, it does make it easier to deal with patients because I have all the information that I need on the system.
We went through an incremental and phased approach. We did some of the simple things first, getting the basics right, our technology, our infrastructure, and then we've built on that success, in an incremental way by then deploying more functionality. Our clinicians have been extremely positive in the journey that we've been on and remain critical to that.
You see in appointments, you can see discharge letters. It's been really useful really for everybody.
We know exactly what they're allergic to or what their GPs have given them, what clinics they've attended. So I think it's a whole picture really, and it allows us to make good decisions, deliver better care.
So anybody from numerous points can access the patient chart, never get lost, they're always there.
Trakcare system is absolutely critical to everything we do now. Everything is underpinned by Trakcare now.
And it just follows them through, so they're coming through A&E, they're already on the board, and then they get transferred to us, so that all of the medical notes and the allergies, everything, all the alerts are just followed them right the way through to when they come into hospital to when they actually get discharged and go home.
With an EPR, as well as replacing other clinical systems, we can also develop functionality that traditionally we would need to go out and buy a new system for. So it allows us to manage our estate in a more joined up and pragmatic way.
And we're still constantly optimizing it, so more and more records are available within Traks, including their previous clinical medical history, their medications, and now their prescriptions.
Before EPMA, we had a completely paper-based medicine chart that was handwritten. There was lots of issues with handwriting, being able to get hold of the actual chart.
The doctors will go on the computer and write them up on NPMA, and the nurses can view them straight away.
You can see when it was actually last given, so you're not giving doses too early and putting the patient at risk.
When they just go around with a computer on wheels, and they'll go around with that, which has got a meds trolley underneath. It's a lot easier.
The prescription of the medications is simple. And it's nice and clear, at least, the nurses understand what's written down because it's on the screen.
So obviously Trakcare's made a massive difference.
It's an all-encompassing system, isn't it, across departments and, and directorates, so it tries to do a lot.
Using EPMA does feel a lot safer.
I think I'm probably 80% through my original vision, which is to make sure that this organisation gets the maximum benefit from its investment in an electronic patient record.
So we've just actually, it so happens, finished uploading patients' outpatient letters onto Track.
That we've just done a 2-week pilot for, and a new fluid balance chart added in there.
So patients now who've attended any outpatient clinic in the hospital in the last 3 years, all their letters are visible on Trakcare.
And ultimately, I think once we've got all of the systems in place, it's just going to improve patient care like no end, really.
I'd recommend Trakcare because it's just a lot easier to use.
But we're also then creating the foundation to create an integrated health and care system. And I would say I'm probably 20% along that journey.
It's a lot more efficient than any of the other ones we've used.
Initially, I think it was a provider and user relationship.
I think it's a very configurable system. I would certainly give it at least a 9 out of 10 at this point in time.
And now it's become much more of a partnership that has evolved, and they develop systems that we require. So that relationship has got closer.
I think everywhere needs something like this to be able to help them just to function, really.
I think they've shown a lot of devotion to improving the system.
Because the activity is so high in the NHS at the moment.
Ensuring that they help us provide the best possible care for our patients, which is the underlying reason that we all come to work.